We're talking about the hormone that everybody has, right? That is the estrogen. Everybody has estrogen, right? When people hear estrogen, what comes to mind is, oh, it's female hormone. You are correct. Oh, menstrual cycle. Yep. Oh, puberty. You are correct. All of which is true, right? But it's incomplete. It is incomplete. Level 20. Idara, wonderful. Make a dance for you. Thank you. Level 20. That's massive support. Massive support. I do not take your support for granted at all. Thank you. Thank you. So if you are following me, you've not drop a heart me, claim your points up here and grow your level, right? Grow your level. All right. Level 20, that's big. It's big. It takes a lot of effort. It takes coins and good tapping to get there. Thank you very much. Right. So I was saying, we're talking about estrogen. And I said, if everything I mentioned comes to your mind, you are correct. But it's incomplete. Right? It's incomplete. Because estrogen is not just a female hormone. You're welcome, Idara. Thank you. Estrogen is not just female hormone. Right? Estrogen is what you call a regulatory powerhouse that influences these few things like egg development, uterine preparation, hormone timing, when some hormone should rise and fall, right? It does that. And even male fertility is also relevant in male fertility. And the key is, it is not just about having the estrogen, right? It is about having the right amount at the right time. That is the key. Is that okay? Who is still here? Talk to me in the comment section. Just type, I'm here. Let me be sure you are there. Why we talk about estrogen? Very important hormone. And as usual, I'll make it as simple as possible for everybody, whether you saw the four wall of a classroom or not, you will understand it. Remember, in the last days, knowledge will abound. So this is one of the knowledge that will abound. So if you're still here, Assurance Baby is here. All right. Now, let's talk about estrogen. What is estrogen? In the simplest possible form of explanation. What is estrogen? All right. Now, Baby Astro, I see your question, but I need you to tap on your screen. I need you to follow me. I need you to share the live. When you do all these things, you help other people to ask questions too, right? And of course, I will answer your question. So let's keep the likes coming. I will answer your question. If you will be patient enough, because sometimes people come, ask question, you don't ask them in 1 minute, off they go. Why? Because they are only asking for themselves. But we are here for everybody, right? I will be amazed the massive support I get from our subscribers. Not because they are trying to conceive, but they believe in what we are doing. So it's an encouragement. And whoa, April, I see you. Hi, good to see you. Right. So we're going to talk about what is estrogen in the simplest possible term that everybody can understand. Are you ready for that gist? I'm always fine. I'm always fine. I'm always fine. I'm always fine. Thank you very much. What is estrogen in the simplest possible term? Now, estrogen is a group of hormones that is produced mainly by the ovaries in women, right? And in smaller amounts in men. Is that okay? Its role in fertility is to build, is to prepare, is to coordinate the reproductive environment. So this is what it does. I'm trying to say it slowly so that those who are, I want everybody to catch. Is that okay? So the role of estrogen is to build the reproductive environment, to prepare the reproductive environment, and to coordinate all the activities. Think of an event planner, right? That is estrogen. So when you think of event planner, you're thinking about estrogen. That is what they do. Their job is to build, prepare, and coordinate what is going on. And many of you who have done what do you call it now, hormonal profile or assay test, you look at your result sheets. What do you see? You look at all the levels of hormones they write there. So you want to carry it and look at estrogen. We're talking about estrogen today, right? So let us look at the main roles. It's not just one of estrogen. Number one, egg development. Egg development, right? Sibongile, I see your question, but you need to exercise patience. Just engage. Tap on your screen, comment in the comment section, engage. When it's time for questions, I will answer that. Is that okay? All right. So the first main role of estrogen is egg development. You know, during the first half of the cycle, estrogen rises as follicles grow, right? The same estrogen supports the maturation of dominant egg. Very key role. So when it comes to egg development, estrogen is there. Maturation, estrogen is there. Is that okay? So that is the first role of estrogen, egg development. The second role is uterine lining growth. Remember uterine lining? Yeah. That is the second role. Estrogen thickens that endometrium, the uterine lining, right? It thickens it. Why? Because the goal is to make it thick enough, soft enough. Then, of course, with the help of progesterone, nourishing enough, right? So it creates a soft, receptive surface for implantation. Remember, even if fertilization takes place and implantation does not happen, there is no pregnancy. So what is the goal? We want fertilization to take place I will also want it to be able to implant, because there are steps to these things. Is that okay? That is the second thing. The third main role is ovulation trigger, right? It triggers ovulation. Why? Because high estrogen levels will signal the brain to release LH, right? Remember LH from our discussion? If you've missed any of the episodes, it will be smart for you to go to YouTube, to my YouTube channel. Just search my name, Dr. Godwin EMB. All the information you need with respect to reproduction is there. And subscribe to me also. So we've talked about LH. LH is the trigger hormone for ovulation. So estrogen is a regulator in this business. So what does it do? It speaks to the brain. It says, hey brain, I want you to release LH because it's time for us to ovulate. Right? So that's how it works. So the high levels of estrogen will signal the brain to release LH. And this leads to ovulation. Is that okay? That leads to ovulation. Now I don't know what number we are now, but whatever number we are, the next one is cervical mucus production. The almighty cervical mucus. Some people consider it offensive. Please don't be offended at your cervical mucus. It's a blessing, and it's also an indicator, right? So you have to be smart, know how to read it. Is that okay? Joy, thank you for the follow. I'll follow you back ASAP. Right? If you're just joining, you want to follow me. Let's talk about your fertility. Is that okay? So cervical mucus production is another big role for the estrogen, right? Because estrogen makes the cervical mucus clear, stretchy, and sperm friendly, right? And the whole essence is so that sperm can survive and travel through it. Because normally, the mucus in the cervix is like a plug. It does not allow anything in, including sperm. But as ovulation approaches, the mucus will change, right? It changes, enabling the survival of sperm and for it to pass through. So for those who have been here, I already told you why nature is that way. The reason why nature puts all those checkpoints, there's a reason. It's not just there for, right? There's a reason. So that is that's one of those roles. Cervical mucus. Estrogen will do that for you. Then estrogen, remember I said is a hormone that coordinates, right? So it supports hormonal coordination. Hi, Jatao Kasama, you're welcome. Right? Why? Because estrogen communicates with the brain to regulate the entire cycle. The rise and fall of estrogen is a message to the brain that, okay, release this one, reduce this one, put this one like this, let this one flat out. That's what estrogen is. Like the orchestra that makes the whole cycle work, right? That's estrogen. In women, also know that there's estrogen in men, right? Of course, we know estrogen is female hormone, but we still have estrogen in men, and it's also a very important hormone in men. but it's rarely discussed. But trust me, I will tell you all the details, right? All the details. So men also need estrogen. Is that okay? Men also need estrogen in small amounts. If the amount plenty, your boy will be doing girly things. So. Have you seen all those boys that are behaving like Pepe here that they want to roast? Have you seen all those boys? More likely estrogen is too much in your system. Right? So estrogen is in small amounts in men. Small amount. And what it does, its relevance in men is more likely JT will not be doing well, right? So what estrogen does, it helps with sperm maturation, right? After sperm is produced, it needs to mature, and there's a process for sperm maturation. It also helps to balance libido. That's why I said yes. John Thomas may not do well if there's too much estrogen, right? So it helps to balance libido, the ability to want to knack. You know that some people their knacking taste is too high and some is too low. So estrogen helps to strike the balance for libido, right? Because it plays a role in testosterone production, right? Then, of course, as usual, it is an hormonal regulator, right? It has that, it regulates hormones. So it does that in men too. So too much or too little in men can disrupt fertility. So it's a very important hormone in men, even though it's in small quantity. That small quantity is very important. You cannot play with it. So what then is a balance? You keep on saying it's relevant for balance. What then is balance, right? It's not necessarily whether it's high or low, even though that's what balance means. It means appropriate levels, right? Appropriate levels, because there are certain times it needs to go up, there are certain times it needs to come down. So it's not a question of whether estrogen is high or low. Is it appropriate? Appropriate levels at the correct phase of the cycle. That's what balance is. So the next time you hear estrogen balances the hormone, that's what it's doing. At every phase, it has the level it should be, right? So if for some reason estrogen is too low in men, so let's start with women, right? If estrogen is too low in women, Fario, thank you for the likes. If estrogen is too low in women, what happens? What happens? Well, it means egg development will be poor. Remember, we need quality eggs. But now, estrogen is too low in women, so we have poor egg development. Thank you very much for the likes, Gladys Golden. Thank you for the follow. I'll follow you back ASAP. In women, if estrogen is too low, there will be poor egg development. Poor egg development. Right? We need egg to develop and mature for pregnancy to occur. So if estrogen is too low, egg development becomes poor, and we may not get the desired results. It's certainly going to affect your fertility. Thank you for the follow. Right? Also, if it's too low in women, right, Thank you for the roses. I appreciate you. If it's too low in women, the uterine wall or lining will be thin. Remember why we need a thick wall? Because we need implantation to be efficient. So now the uterine lining is thin because of too low estrogen. You cannot afford to have estrogen too low, right? It also reduces cervical mucus. Remember what it does? It's supposed to help make it egg white, stretchy, clear, and support the survival of sperm. But that estrogen is too low, sperm cannot survive because it is too thick. All the sperm is being trapped in the cervix. So many things to look at. And if it's too low, there's also the issue of implantation problem. So one of the things that your doctor will be looking for is the level of estrogen levels, to be able to tell one or many of these things I'm talking about. Is that so? Is that okay? Now, what are the common causes of too low estrogen? Estrogen is too low. Why? Why is estrogen too low? Who is ready for that gist? If you're ready for that gist, talk to me in the comment section. Just type ready. Type ready. Common causes. Remember, we're talking about when estrogen is too low in women. What are the common causes? Why? Why is estrogen too low? Right? Why is it too low? Common causes number one. Right? If you're just joining, you're welcome. Please tap on your screen, share the live. Share the live. Sorry about the stillbirths. Sorry about that. I'll answer your question when we are done, when we are ready for question and answer. Please tap on your screen, share the live. Make sure people who are trying to conceive are here. If you're not trying to conceive, there's a lot for you to learn. And if you're less than 18, get out of here. It's not for you. All right. So common causes of low estrogen include low ovarian reserve. Low ovarian reserve. I'm going to talk about that in detail maybe before the week runs out. Low ovarian reserve, right? In other words, what is the level of eggs in your reserve? Is that okay? Another one is excessive exercise. Is that all of you that are hitting a gym? I don't know what I want to do. You're just working out. You want to kill yourself. So, excessive exercise reduces, it makes your estrogen drop, right? So, the third one is underweight. You're too thin. Right? You're underweight. Your estrogen will be too low. Anything that affects estrogen will affect your fertility. So remember, we say you cannot be too thin and you cannot be too fat. I'll say it as it is, so that we will not romance the matter here. And when hormone is suppressed, it also means that estrogen will be too low. It's an hormone also, right? Is that clear? Is that clear? If it's clear, just type clear in the comment section. Because it's very important you are learning this thing. Now you know the reason why estrogen can be too low, right? Low ovarian reserve, excessive exercise, underweight, and hormonal suppression. Now you know. Where would you have known that before? So that is if estrogen is too low. So if estrogen is too high, because we should be talking about balance, right? If what happens when estrogen is too high? We've seen what happens when it's low. When it's too high in women, what happens? You're not talking to me in the comment section. Talk to me. If you're still here, just type I'm here. Let me know you're there. You're listening. If you miss anything at all, just go to YouTube, search my name, and all the information, all the past episodes are there. I tell you, if you will listen to the videos, watch it over and over and over again. If you don't carry belly before December, we'll see what will happen. Lovely Ifechukwu is here. You are welcome. You're welcome. Good to see you. All right. So we're talking about what happens when estrogen is too high. Who's ready for that gist? Thank you, Daddy's girl, for the likes. When estrogen is too high, very important hormone, but now is too high. Why? What happens? In women, when estrogen is too high, it disrupts ovulation. It disrupts ovulation. Right? It also would amount to hormonal imbalance. Right? And you may have heavy or irregular periods. I will say it again. In women, if estrogen is too high, it disrupts ovulation. If you're just joining, we said some things before you came, so you want to go back to the videos later and watch it. Right? Too high estrogen will disrupt ovulation. It will amount to hormonal imbalance, and it causes heavy or irregular periods. Heavy or irregular periods. So am I beginning to answer some of the questions in your mind? I promise you are going to learn something. So long as you are here, you will learn something. Right? So what about in men? If estrogen is too high? Of course, there's supposed to be small amount of estrogen in men. So now it's too high, higher than the required balance. What happens? In men, as estrogen goes up, testosterone levels go down. The effects of testosterone is no longer there. What are the effects? Baritone, right? That baritone voice that is making you feel jiggy, right? V-chest, muscles, right? The things that make you manly man, right? The effect is reduced. Right, testosterone. I was talking about those gelly boys. Testosterone is too much, right? So it reduces the effect of testosterone, and also it will impair sperm production. So that's why it should not be too much in men. There's a required quantity, which is actually a small amount, right? So that's the effect of too high testosterone in men, right? So what are the common causes? What will make testosterone too high? Why? What will cause this thing? If you are here, just type ready. You are ready to hear why testosterone can be too high? Estrogen, sorry. Why estrogen can be too high? Talk to me in the comment section. Just type ready. Hello, Catherine. Common causes why estrogen can become too high. Why? Number one, Priska, you're welcome. Esther, I believe I'm correct. You're welcome. All right. Common causes why estrogen can be too high. See, after today's information, you now know how to adjust your lifestyle to solve some of these problems. Dolly Go, thank you for the follow. I'll follow you back ASAP. Right? Common cause number one, excessive body fat. You see why I asked you to go and cut down your weight? You're big. Excessive body fat. It's actually a positive feedback mechanism. It's a bundle of confusion, right? Now, estrogen levels would influence fat production. As fat production increases, it causes more estrogen. More estrogen, more fat, and it keeps on. It's a roller coaster. Marigo, thank you for the follow. Right? Excessive fat. So if you are just joining, you need to go and find out the effects of when estrogen is too much, so that you know why you must cut down your weight. Right? Excessive body fat, whether a man or woman. Right? There are certain medications. That will cause estrogen to be too high. There are. But I will not mention them because I don't mention drugs on live stream. Certain medications. Okay, let's take, for example, some of you that are using hormonal, what do you call it now? Hormonal contraception. You don't notice for some of you, not all of you, from when you start, more body just they gather, right? Teresina, thank you very much. Thank you for the hearts, me. I appreciate you. Have you not noticed? When you started the family planning, body just they gather. Why? This is the why. So it falls under certain medications. Also, where there is a hormonal disorder, yes, it can make estrogen to be too high. Is that okay? And the worst one, which we can almost not dodge, is environmental exposure. Teresina, let her knock now. Let her knock. She will be pregnant. Unless there is some other concern you want to talk about. All right? Environmental exposure. And I was looking at some of the things I noticed, especially for those in... I noticed that people in America, I think there was even a study, they are prone to being big. That falls under environmental exposure. Whether it's in the food, whether it's in the environment, whether it's in the water, whether it's in the things they use on their body and all that. So environmental exposure can also make cause estrogen to be too high. Right? Don't worry about it. You will be fine. Just let us understand your case. It's not to get belly. Just follow what I'm teaching you. Unless you have a special need, then we can now direct you to where you can go and solve your problem. Majority of the infertility problem is ignorance. So just learn first, then we will know where your problem is. Is that okay? All right. So that's the common causes of high estrogen levels. Right? Oh boy. Right. Um let's see conditions that are linked to estrogen imbalance. Conditions that are linked to this estrogen imbalance. And remember, in fact, we cannot even say anything about it unless we mention this notorious one, PCOS. PCOS is a notorious condition. I'm going to talk about it. I think next week I'm going to talk about it. So if you want to hear about PCOS, make sure you don't miss the live stream next week. It's a notorious condition. Right? This PCOS, the hormonal imbalance in this situation affects ovulation and estrogen patterns. Thank you very much, Teresina. Right? So we'll discuss the details next week. Is that okay? Thank you very much. Now, the other one is endometriosis, another very notorious condition. Right? It's because estrogen can promote the growth of abnormal tissue. Right? So those conditions are linked to estrogen imbalance. Estrogen must be balanced. So if there's estrogen imbalance, these are the things they'll be managing for you. Now the almighty fibroids. Fibroids. Somebody asked the question, this fibroid, where is it coming from? Who invented it? Who brought it? All right. The simplest thing you need to understand, first of all, fibroid, estrogen is fingered in the development of fibroid. Right? The simplest way I can put it, there's a more technical way, but the simplest way I can put it is this. Estrogen, fibroid is a growth that is a growth that comes due to the long-term exposure of the uterus to estrogen. Right? This is an estrogen sensitive growth. Right? So estrogen keep influencing the muscles of the uterus 1 year, 2 years, 3 years, 20 years, 30 years, 40 years, and the uterus is begging to be pregnant. It's not saying pregnancy. So what happens? And by the way, it's genetic anyway. It's more common among black people, right? It's more common among black people, but again, is estrogen sensitive. Estrogen is the culprit in this thing, right? Especially for early bloomers. You know what I call the people I call early bloomers? Those that attain puberty early. Thank you very much. MSEG is here. Hello, MSEG. You are welcome. Early bloomers, those who attain puberty earlier than others. So estrogen has started influencing your uterus longer than any other person, right? Nothing is wrong with you, but just that we live in a day and time where people don't take childbearing seriously. So what happens? We can stay up to somebody who attained puberty at the age of 12, maybe 10, maybe anywhere in that bracket, and they are not interested in having kids up until 35 years. My sister, fibroid will show. Why? Because of that long extended exposure to estrogen without carrying, because your uterus is designed to carry something. I used to tell some of my patients, I say, see, this uterus is designed to carry something. If it does not carry that thing over time, it will produce its own thing, right? So that's the simplest layman understanding. But remember that estrogen is one of those things that is fingered to cause the fibroid, right? Is that okay? If you are still here, talk to me. I know the network is kind of unstable, right? So we've talked about the role of estrogen with respect to the uterine lining, and that one of the key role, it builds the endometrium, right? So if the lining is too thin, embryo cannot implant. So we need the influence of estrogen to do that. If it's too thick or abnormal, implantation may still fail, right? If you are just joining, you're welcome. You're seeing me for the first time, you want to follow me, tap on your screen, share the live. Make sure people who are trying to conceive get to find us, because is that Janet? Janet is here. Hello, Janet. Good to see you. Right? So, we're saying that if the lining, uterine lining, is too thin, embryo cannot implant. If it's too thick or abnormal, implantation may still fail. What is critical is balance. Balance. Hi. Ngwane, yes, you should get pregnant this year. Right? Now, let's look at lifestyle factors that is affecting estrogen. I know you are interested in this one. Right? El Manuel, you're welcome. Good to see you. If you're just joining, make sure you're following me, share the live, tap on your screen, and drop a heart me if you've not dropped a heart me before, right? And claim your points, please. Don't just let it waste, right? So let's talk about lifestyle factors affecting estrogen. With all these things we know about estrogen already, what are your lifestyle factor that is affecting it? Who is ready for the gist? Who is ready for the gist? You will get pregnant, don't worry. Who is ready to know the lifestyle factors? One person wants to know the lifestyle factor affecting estrogen levels. The first thing is what I mentioned before, body weight. Body weight. Fat tissues, if you don't know before, I'm telling you now. Fat tissues produce estrogen. Fat tissues produce estrogen. So as you are growing bigger, more estrogen. And the more the estrogen, fat tissue. The more the fat tissue, more estrogen. The more estrogen, fat tissue. So it's a positive feedback mechanism, right? So fat tissue produces estrogen. So excessive weight means high estrogen. And low weight, if you have low weight, especially those that are underweight, you know what that means? It means low estrogen. So you too, you are not out of the hook. Your fertility will be affected too. So too much weight, too much estrogen. Low weight, low estrogen. All of you are in the same bracket. So what do? You want to maintain a adequate BMI. And I want to ask of the 31 people here, how many of you, talk to me in the comment section, please. How many of you know your BMI? I want to know. Talk to me. I want to take census of those who are really concerned about their health. How many of you know your BMI? And please, if you don't know what BMI is, just type in the comment section, what is BMI? Right? You know your BMI. Okay, good. Is that me? But is it normal? I want to see if we can help one or two persons calculate theirs tonight. Do you know your BMI? If you're just joining, you're welcome. Make sure you tap on your screen. If you have not followed me, follow me now. If you want to ask questions, make sure you are tapping on your screen. At least 1K before I can answer you. Okay, good. Oreayo. Good. Excellent. Excellent. You're just borderline, but you're good. Just make sure you keep it low, right? Keep it within the brackets. Go down back into the less than 25. You'll be fine. If you are just joining, welcome. I see you. Okay, I understand. Okay, that would mean that no answer means that everybody knows their BMI. I wanted to help. Who is that person that said she doesn't know what BMI is? Okay, BMI is just this is the way to understand it. It's not just how big you are. The question is how much of your weight compensates your height. That is how you define your health, right? So BMI is your weight over the square of your height, and it gives you an idea whether you are underweight, whether you are normal, or you are overweight. Even in the overweight, there is category. You can be overweight, you can be obese. Even among the obesity, there's still category. There's obesity 1, obesity 2, obesity 3, with a lot of health issues, right? So I hope I did love you understand what I mean. So how do you know? All you need to do is make sure you know your height and measure your weight. Go to Google, look for BMI calculator, put all the relevant information. It will tell you whether you are normal or underweight or overweight. And if you get that information, learn how to keep your weight normal, right? So I said all that to say that body weight will affect estrogen levels. We're talking about lifestyle factors that's affecting estrogen levels, right? So the first one is body weight. Next is diet. Diet. Certain diet influences hormone metabolism. I will not talk about it here. Right? That one. Come to my DM. Just go to my profile. Go to my profile, look at that link, come for consultation. I will tell you all the things you need to do that will help you with what we are talking about. If you come to my DM, I will not answer you. Just go through that link. All right, where was I? Also, environmental factors, like when you are exposed to environmental chemicals, exposure to hormones, more like endocrine disruptors, right? Because these chemicals in the environment can mimic estrogen, causing women a lot of problems, right? I've bashed the system this week a lot, so I don't want to talk about this too much, so that TikTok will not take me down, right? But everything in your environment is fighting against your reproductive health, including the one you are buying and putting on your skin. Whether you're putting on your lips, your eyes, your face, your head, your hair, you want to smell nice and all those. Everything is fighting against you. So that is what we call environmental factors, including the food, preservatives on the food. All right, the next one is stress. Stress actually has an indirect effect, right? Because when you are stressed up, the hormonal pathways are disrupted. So it's going to affect estrogen levels. So that's how stress would affect. So I have already talked about how to manage your stress in the last episodes. So you want to check it out on YouTube. Search my name on YouTube, Dr. Godwin EMB. You'll find it there, right? So stress, manage your stress. Is that okay? Manage your stress. Manage your stress. All right, let's take some questions before I go. I want to go early today. But before then, when should estrogen be evaluated? When should you be concerned? When should you be concerned about your estrogen? Now, if you have delayed conception, you've been trying to conceive, it's not just happening, go and get evaluated. If you have irregular cycle, go and get evaluated. If you have abnormal bleeding, go and get evaluated. If you are even suspected to have hormonal imbalance, you go and get evaluated. These are the things that you need to do. This is the clarity you need, right? That's the clarity you need, right? That is the clarity you need. So estrogen actually builds the stage where pregnancy begins, right? It must rise. It must maintain a peak and fall in the perfect timing. Why? Because in fertility, it is not about having hormones. It is how well they work together in sequence. So that's why when they do your profile, they look at some things. Your doctor will help you out. But at least the information I've given you today, I've given you some clarity on what next or what direction you should go in the coming days. So if you're trying to conceive, don't sit on this information, right? Work with your doctor and let us see where it leads. Is that okay? So if you have tapped and you want to ask question, please ask your question. Otherwise, it's time for me to go. Send in your requests.